Okay.
We actually didn't stop. Please, ring me and tell me I've got the job. I had my notice written out that night.
That's right. Interesting. Right now, maybe uncomfortable question. How much you hate clinicians? Are we our biggest princesses? Are we our biggest princesses ever? We have to. Hi, it's Izabela here and 21D. So today we have Beth, one of our nursing team. So Beth, tell me, how long have you been working for 21D?
So I'm Beth, I'm one of the 21D nurses, and it was actually my first year anniversary yesterday.
Congratulations. Yeah. I did not know it's been the whole year. That's interesting.
Yeah.
So how long have you been nursing for in general?
In general, about 9 years now. So I was in NHS for about 8 years before I come to 21D.
Okay, right. So how much different is working on NHS comparing to 21D?
It's a whole different kettle of fish, isn't it? I think anyone who's come from any kind of dentistry at all, as soon as they step foot in these doors, it's like a whole new world. Like I felt on my first day, I felt like I was training all over again, like I'd gone back 8 years and was back on my apprenticeship. But I wouldn't change it for the world. I could never go back.
What did you do, just general dentistry, or did you have some additional roles?
No, so we did general, a bit of private work, like private white filling, stuff like that. No implants at all. I'd never until I came here, I'd never seen an implant be done.
So what about surgery? Have you done any surgery before?
No.
So when you came and you look at the complexity of our surgery, did it not freak you out a little bit?
No, I absolutely loved it. I was like, so initially when I applied for the job, I thought I've got absolutely no chance. Like I've got none of these like qualifications in any other aspect of dentistry. I've never seen an implant be done before. I've never been involved in sedation. I've never done any scanning. And I thought, you know what, just go for it. Just what's the worst that you can do? And I remember getting a phone call off VJ saying, I've been told to ring you, blah, 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 and can you come in and have a look round? And I remember coming in and I was just like blown away. I obviously met Hannah and a few of the other girls at the time, and I watched Jason's surgery, I think it was. And I remember just driving home thinking, please, ring me and tell me I've got the job. I had my notice written out that night.
That's right. Interesting. So how did they feel about losing you?
They was good,
I know,
to be honest.
How would I feel about losing you if it would go through your mind to leave 21D? I would be devastated.
Never.
So Beth, you've been 12 months and you accelerated so fast. I've seen you progressing from not knowing much, and I think I've made you cry myself once. So I do apologise.
It was only over a water flask, so we can forget about
that. But yes, right now, Beth, you are teaching other nurses, aren't you? In all aspects. So it's surgical, non-surgical, a bit of a decon, a bit of a admin, everything, isn't it?
Yeah. I think that's one of the important things about coming into 21D is I remember actually when I got the job and I only had my first day, going a year ago, VJ actually said to me, he said, if you're in the same position in 5 years' time, you're out them doors. And I think that's a big thing with 21D. Like in general dentistry, you can't really progress. You can't, unless you become, lead nurse or this and that, there's nowhere to go.
Yeah.
But within 21D, you can just keep growing and growing and growing. And it all comes with like the love you have for the company as well. Like everyone here, it's not work to a lot of us. It is work, but you want to see the company grow. You want to see it succeed. You want to see it, obviously in the near future, you want more places.
Why this is important? Why do you want more patients? Why?
Because you see how many people are in need of what we do, and you see how it changed people's lives, and you want to give that to as many people that need it, basically.
That's very well said.
Yeah.
So tell me, what is your favourite part of the day?
My favourite part of the day?
Well, except, 5:30 going home, but...
Working with you, seeing the rotor and I'm with Izzy for the day.
Interesting, yes, because we're in the front of the cameras. But no, the part of the patient journey, what is special for you?
I think for me, there's a lot of different parts. Obviously, one, when you're involved in the FCAs, you see how much courage it's taken for them to come. A lot of them don't want to be there. They're there because they have to be there.
Yeah.
And you appreciate that they're putting the trust in you.
Yeah.
And then we get to surgery and, once that started, there's no going back.
Yeah.
So it's like you appreciate the fact of they're risking everything, they're putting all of their trust into you. I know I wouldn't like to be sat in that chair, but if I had to be, I would. And it's just, what I love the most is how every aspect of 21D comes together. No one could do their part without another member of the team. So we wouldn't have the patients if it wasn't for treatment cohorts. We wouldn't, the bioengineering wouldn't be able to do what they need to do without the nurses and the clinicians at the FCAs. Then surgery wouldn't be able to do what they have to do without the bioengineering. So it's just, I think I appreciate the whole thing because it's mesmerising what can happen.
I'm glad that you said this because lots of dentists and the nurses saying, a favourite thing is when we feed the LTPs, when we feed the prostheses, and then they look in the patient's smile. But I'm glad that you say that it's the whole process.
Yeah.
Okay? It's a whole process that's important, and the courage of the patient coming in, then again showing up for the surgery, and then the last kind of a little bit of being nervous.
I think the fit is just the cherry on top of the cake, isn't it? Really.
Yeah.
People say I love it because they get the smile back, but in general they get the whole life back. Like you see the general health improve. You see a lot of posts in the Facebook group and they're like, I've lost so much weight that I've never been able to lose, and my diabetes is better, and because you've got rid of so much disease, it's not just
it's just
a smile, it's everything.
A puzzle in a big picture, isn't it? But very often it's the kind of the last piece of the puzzle. So
is that smile?
It just lets you leap forward, lets you make this jump, this decision, to improve the life. Okay, so Beth, right now, maybe uncomfortable question. How much you hate clinicians? Are we our biggest princesses? Are we our biggest princesses ever? We have to. We like to
do you know what? In surgery, it can get quite intense. It's not, I think everyone manages it very, very well when you're not expecting something. Obviously there's stages to the surgery that happens no matter what. But certain things don't go as smooth as you want it to. And people...
The dentist getting frustrated.
They get frustrated, but at the same time, until 21D, I've never felt as appreciated by dentists as, before you was just a nurse. Now you're a 21D nurse and you have a lot more responsibility and you're appreciated and valued. And when I joined 21D, I was like, I actually have a voice. I have a voice. I can, I'm so involved. A lot of it is very nurse led, and I think everyone gets a bit frustrated and a bit snappy at times, but we all love each other. We're all one big dysfunctional family.
And what about patient, when the patient is difficult during the surgery? Is this difficult to manage?
It is. It can be. Simple fact, it prolongs the surgery. It's...
when the patient is not cooperating,
if they're not
listening to you?
Yeah, it's hard because obviously you can appreciate it's very tiring to have your mouth held open with gadgets that are like torturing devices. But yeah, I always think just listen to us, just cooperate. There's always at least 4 people in that room.
Beth, how many times have you been doing it? For how many patients? Hundreds and hundreds.
Yeah.
Over the year, it was hundreds and hundreds, right? So if Beth is saying, breathe through your nose, just count down, slow down, basically she knows what she's doing, right? If she is helping you swallowing the tablet when your mouth is completely numb and everything is drooling and oozing and everything, just listen to the nurse, because she is your chairside angel. I always say it, chairside angel. They know what they're doing. They've done it so many times. They're the most kind, the most caring people. So please appreciate your nurses, because they're far nicest people than a dentist in general.
I think as well, like you're always, obviously there's sometimes more people, but in general you're going to have at least 4 people in that room.
Yeah.
So the patient in the chair, and then you've got your clinician, and always 2 nurses, regardless.
Yeah.
And everyone in that room has one priority, and that's the one in the chair. So no matter what, as soon as we walk through that door, no one else matters apart from that patient who's sat in that chair.
That's true.
And if we're telling you to do something, it's for your safety. So if we're saying 10 times, please don't put your hand near your mouth, please don't put your hand near your mouth, it's because we're looking after you.
Yeah.
You know, and everyone's priority is to keep you as safe as possible and to, you know, get you in and out, basically.
So I just need to add, because I've watched Beth growing as a dental nurse, as a 21D dental nurse over 12 months, but I also seen her on the other side as the best caring mom to a 6-year-old.
Yeah, she's,
6-year-old, and achieving personal goals in fitness world. Respect. Because not everyone can manage to fit a busy life as being 21D dental nurse with being a mom and achieving amazing results within their all fitness and body and health. So as I said, big respect.
Thank you.
Okay, I think that's it. Thank you, Beth, very much for coming and spending some time with us.